I've been on a lot of different medications to find out what works. About 2 years ago, I didn't have to take anything. I only had to take, there was something called Ultram. I would take that twice a day. And as my pain progressed, then I move up Percocet and Oxycontin for home. And that's now when I take it home when I'm in pain. Or Motrin. If my pain doesn't go away within a day, then I say, okay, it's not going anywhere, I need to go to the hospital. I usually wait a few days because I try to see if it's gonna go away. I try to wait and see if it gets better. And if it doesn't, then I say within 2 days, then I say I'm going to the hospital.
And then if you go into the hospital, what kind of medications do they put you on to help bring it under control? What kind of regimen do they put you on?
You get pain medicine every 3 hours usually. It's Dilaudid and Toradol. Dilaudid is the narcotic that they get for pain. And I think they say Toradol is kind of like Motrin every 6 hours, and the Dilaudid every 3 hours for pain when I'm in the hospital.
And then, so how does that work? How does that, how do they get you stabilized, or whatever the right word is? How do they make that, get you back to a point where you feel like you can function again?
It has to happen on its own. You have to wait for your pain to go down. Hopefully the medicine works and it'll go away within a few days. But if it doesn't, and it's pretty much just chronic pain, as Dr. Rana says, then I'll usually go home in pain, but not as much pain as when I came in. Most of the time I go home in pain, but it's not as bad as when I came into the emergency room.